It's a pleasure to be here at the Hem-Onc Pulse event, and we had a very nice session on acute lymphoblastic leukemia. The data was presented by Dr. Short, and in the session we had with us Dr. Guru from University of Wisconsin, Dr. Logavi from MD Anderson, myself. Some of the key topics that were discussed were the use of blinatumomab-based therapy in combination with TKI in frontline Philadelphia positive B-ALL, which is now showing very high remission rates, MRD clearance, as well as long-term survival now above 90%, and may be emerging as a new standard treatment for both young and old patients with Philadelphia positive ALL. The other area that was discussed quite a bit was the incorporation of blinatumomab as a MRD eraser or as a maintenance therapy in patients after receiving frontline intensive therapy for their ALL. And based on the ECOG 1910 study, we're seeing that use of blinatumomab after chemotherapy seems to improve survival in patients who were MRD negative by flow cytometry and has now become a new standard of care. And lastly, a lot of discussion about where the CAR T therapies will fit in the B-ALL space. At this time, these are approved in the salvage setting. However, with emerging data, they may actually be more effective and more suitable and best placed in the MRD positive or even as a consolidation maintenance to avoid allotransplant in high-risk B-ALL. And a number of studies are looking at this approach, especially with some of the newer CAR T cells like obe-cel, which seem to be both very well tolerated, highly effective, and potentially have very long durability. So all in all, a lot of changes in B-ALL in the last 10 years, moving away from chemo, more dependence on TKIs, immune therapies like blinatumomab, inotuzumab, and cellular therapy, and great improvement in survival in both younger and older populations. Looking forward to more progress in the next few years.